Today, we are going to explore sexual and reproductive health, or SRH, not simply as a medical issue, but as a human right. This perspective shifts the conversation from disease control or service delivery to a broader framework grounded in dignity, autonomy, and justice. When we say SRH is a human right, we mean that all individuals, regardless of gender, age, socioeconomic status, or cultural background, have the right to make decisions about their bodies and reproductive lives free from discrimination, coercion, and violence. Human rights rest on the principle that every person has equal worth. They are inalienable. We are born with them, and they do not depend on a government granting permission. Two features are key. 1. Inalienability. No authority can legitimately take them away. 2. Universality. They apply to all people everywhere. These principles are embedded in international instruments, most notably the Universal Declaration of Human Rights, which serves as the basis for subsequent treaties and conventions on health and well-being. To understand SRH rights, we must recognize the foundational characteristics of all human rights. Universality, every human being is entitled to them. Indivisibility, violating one right affects others. For instance, denying reproductive autonomy limits a person's education, work, and life opportunities. Enforceability. Rights are meaningful only if mechanisms exist to demand accountability. And practicability. They must be implementable, not just aspirational language on paper. One significant misunderstanding arises when people equate citizen entitlements with human rights. Entitlements, such as the right to vote or hold a passport, are granted by governments and can vary significantly across countries. Human rights, however, precede nationality. Even if a government refuses to recognize them, they still exist. For example, a refugee denied maternal health care still holds the human right to safe childbirth, even if the host state does not provide it. The right to health is formally recognized in Article 25 of the Universal Declaration of Human Rights, which includes adequate living conditions, access to health care, and social support systems. Importantly, the right to health does not guarantee perfect health, but rather access to the conditions and services that allow people to attain the highest possible level of health. Think of it this way. A person cannot be blamed for developing cervical cancer, but they can claim a rights violation if the state denies access to screening or treatment. The Tavistock Group, in 1999, articulated a set of ethical principles for the right to health that remain influential. Aim: create a shared ethical foundation for all health professionals. Goal: recognize health as a universal human right, not merely a service to be consumed. This ethical shift helps professionals move beyond treating diseases to protecting dignity. Sexual and reproductive health always exist within social, cultural, and political systems. Consider these examples. In some societies, cultural norms restrict women from deciding when to have children. In others, LGBTQ+ people face legal penalties simply for expressing their identity. Therefore, implementation of SRH rights is never just a clinical process. It requires policy change, cultural negotiation, and social commitment. A rights-based approach to SRH demands more than providing services. It ensures informed choice, e.g., deciding whether to use contraception or which method, freedom from exploitation, such as coercive sterilization practices, and affordable access, because a right that exists only for the wealthy is not a right. The Cairo ICPD 1994 was pivotal in connecting human rights to reproductive health globally. Despite legal recognition, SRH violations persist as a common issue. For instance, countries with bans on abortion deny bodily autonomy. Forced marriage violates consent and sexual rights. Lack of contraception access undermines gender equality. The Sustainable Development Goal Target 3.7 explicitly calls for universal access to SRH services by 2030, showing how rights language now guides global accountability. Recognizing SRH as a human right does three things. 1. Promotes inclusion, ensuring all populations are considered. 2. Creates legal and political obligations. States become accountable. 3. Pushes beyond charity models. Access becomes a duty, not an act of generosity. Yet progress is uneven. Many governments accept the language of human rights but fail to allocate funding or enact effective policies. SRH services frequently remain reactive, focused on diseases like HIV or infertility, instead of proactive, rights-centered, and preventative. A rights-based SRH framework must include empowerment to make decisions, freedom from coercion, affordable services, and attention to equity, not only outcomes, but access and control. One striking example: maternal mortality is often measured with DALYs, but this metric masks social injustice. A preventable postpartum death is not just a health statistic, it is a rights violation. Sexual rights extend beyond reproduction. They include the right to sexual pleasure and intimacy, access to comprehensive sexuality education, freedom from stigma relating to sexual orientation or gender identity, bodily integrity, and partner choice. An adolescent who is denied accurate sexual education has had their rights violated, even if no disease occurs. Reproductive rights concern control over one's reproductive life, including the ability to decide if, when, and how many children to have, access safe and acceptable childbirth care, maintain privacy and confidentiality. They are lifelong, beginning before sexual maturity and continuing well beyond childbirth years, for example, through access to menopause care. Institutions play a crucial role in making these rights a reality. They must provide clear supervisory and regulatory frameworks, train health workers in rights-based practice, offer mental health support because reproductive health choices often carry emotional and social burdens, and create peer and community support programs to reduce isolation. When institutions fail, individuals are often left to navigate health systems on their own, lacking both power and information. Viewing sexual and reproductive health through a rights lens transforms our understanding of healthcare. It moves us from providing services to ensuring justice. Whether we are clinicians, policymakers, or advocates, the responsibility is the same: to uphold autonomy, protect dignity, and ensure every individual can exercise their reproductive and sexual rights without fear, discrimination, or coercion. That is what it means to say sexual and reproductive health is a human right, not a privilege, not a favor, but an entitlement born of our shared humanity.